Our lives are made up of daily choices, some big, some small. Being able to turn to someone for help in finding options and information to make some of these decisions can make things easier. The world of healthcare can be a difficult series of choices and becomes even more complicated and frightening when it involves long-term care and the prospect of losing independence. For many elderly and people with physical disabilities, lining up services, making and keeping appointments with physicians and specialists, monitoring their own health needs, and managing a myriad of bills and funding sources can be difficult and time-consuming. It can, in fact, take over their lives and result in less than adequate care and decisions being made for rather than by the consumer. Community Health Partnership builds bridges to health and long-term care options and makes possible one-stop shopping by forging new relationships among consumers, providers, and funding sources. Community Health Partnership is one of 4 organizations that provide this type of fully integrated health and long-term care. Community Health Partnership provides health plan coverage for 2 distinct communities through its HMO entity, Partnership Health Plan Incorporated. The elderly, who are 65 years of age or older, and people with physical disabilities, ages 18 through 64. These individuals must reside in Chippewa, Dunn, or Eau Claire counties, be Medicaid eligible, and meet the Wisconsin level of care criteria for nursing home admission. Most people are also eligible for Medicare, although this is not a requirement. Choice and independence are the cornerstones of Community Health Partnership's health plan. Members are an active partner with an interdisciplinary team comprised of both health and long-term care professionals who together manage the members' specific needs and desires. This team consists of the member, their own physician, a registered nurse, a nurse practitioner, a social services coordinator, and a team assistant. Together they develop an individualized care plan. Examples of covered services include primary medical and specialty care, pharmacy, medical equipment, dental, rehabilitation services, lab and x-ray, hospital, personal care, homemaking and chore services, home accessibility, transportation, daycare, and alternate living situations. Community Health Partnership provides multiple choices for services through its health plan network of over 500 local and area providers.
You know, years ago, physicians made home visits all the time, and there were reasons for that. One is that the physician probably had the ability to get out and get around. The physician owned the horses and the carriage, and so the physician could get out and make a home visit. It's easy for a physician to sit behind an x-ray or sit behind a laboratory test and pass judgment about what's going on. When I go into a home, I see how a person's really living, and I see what kinds of obstacles are in their life, and I see what kinds of problems they have to overcome.
A lot of times we have been seeing a member for a long period of time, have been in the home, can bring a different perspective, and we have that relationship. We listen to the team and the member and bring that perspective of actually what their needs and thoughts are, and we kind of tweak things back and forth and trying to figure out what really is going on.
We need to communicate constantly with each other. We don't function well if we don't communicate well, and that's something that we also strive to do as nurses, is to help keep the communication rolling well on the team and also amongst people who are also on the team, so to speak, but who are in the physician's offices, receptionists, laboratory workers, all become pulled in as part of this team.
We work very hard with them to make their own choices and be as independent as possible. And sometimes they make choices that we might think they could make a better choice, like if they need more supportive home care or more personal care, people coming in and assisting them, and they refuse that. We definitely respect those wishes. Our members may not make the best decisions, but we do always allow them to make those decisions.
They get just the right amount of care. No more. Too much care is invasive and limiting. Not enough has its own set of difficulties and can be downright dangerous. Getting it right's a very difficult thing, and a piece that I think Community Health Partnership does very well.
Members take an active role in the decision process, working as part of the team to achieve the best overall treatment and support.
CHP got me out of the nursing home. Now I am in my own apartment and can do what I want, when I want. Could I live independently without CHP? No way.
There's a huge range of what people need, and that can change on a monthly basis.
Nothing's restricted. It all depends on how disabled you are or how much help you need. If CHP wasn't around, I'd probably be in an assisted living facility or some kind of nursing home.
For her to have to be in a nursing home, I can't imagine at her age to what a bleak outlook that would be. So anything that can be provided for her at her house or running errands, going with her, that's very important to her.
The elderly population that we work with is very dynamic and always changing. People who maybe now are at a point where, they still want to be independent, but they aren't able to be safe in their own home anymore.
Health-wise, it just kept going down, 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 and I went into the hospital with the pneumonia, and I was in there for two days and had a heart attack and thought I wasn't going to make it, but I fooled them, and here I am today. Mother and I baked a batch of cookies this morning, and if it wouldn't be for CHP, we probably wouldn't be here.
If it wasn't for them, we wouldn't be here. We wouldn't. We wouldn't have gotten the doctor, the medicines, or the care they were getting.
Kind of always monitoring what exactly is going on in someone's life, what might be changing soon, and then adapting to that, and trying to kind of foresee things before they happen if possible, and if it's not possible, then react as quickly as we can once it does happen.
Community Health Partnership receives a specific Medicaid and Medicare payment for each member and has maximum flexibility in purchasing and organizing services to meet all of the health and long-term needs of its members. Community Health Partnership is a win-win plan for both members and the community. Through increased prevention and better management of care needs, there can be a decreased need for more expensive services like emergency rooms, hospitals, and nursing homes. Community Health Partnership is cost-effective and supports nearly 95% of its members to remain in their homes while enjoying a greater level of independence. Community Health Partnership has been building partnerships and fostering the independence of members since 1997. As a model integrated health and long-term care program, Community Health Partnership's holistic approach not only meets the present needs of area individuals, but recognizes its responsibility in maintaining the health of the community well into the future. Community Health Partnership. Partners in health, partners in choice for quality of life. And that's a choice that should be there for each and every one of us.
Our mission is to foster and empower people to be as independent as possible, and that's about growing people to be able to have more control over their life, to manage their life, to have choices. It's also about the ultimate dignity for a person in being able to be the most that they choose to be in terms of their level of participation, their level of control over their life. It goes to the very root of what our souls are about. We want to be treated with dignity, but we want to pass that on, and so it touches staff and our members. It touches our providers. It's about how people can be stronger because of our interaction with them, whether it's emotionally or physically.